welcome back. I'm here now with Niall Brennan, founder and CEO of the Healthcare Cost Institute based in Washington, D.C. Welcome.
Hi, Mabel. It's great to be here.
Nice to see you. So tell me about the work of the HCCI. You're an independent nonprofit research institute?
Yeah, we were founded about 8 years ago. There is a lot of unknowns about American healthcare. We know we spend a lot of money, but we don't necessarily know why so much money is being spent. So in a relatively unusual partnership, 4 major payers, United Healthcare, Aetna, Humana, and Kaiser, agreed to set proprietary instincts aside, pool their data with a trusted third party that became the Healthcare Cost Institute, and then we both analyze the data ourselves, release cutting edge research that helps people understand why healthcare spending is the way it is, and then we also provide access to the data, highly controlled access to the data, to academics at Harvard and MIT and Stanford and the like.
Okay, and have you found that veil being lifted a bit with all the data that you provide, and do organizations move on the data?
So the veil has definitely been lifted. I think it is shocking to people to, really understand what the drivers of healthcare costs are. I think in particular are insights that have shown that in many cases it's not Americans consuming more healthcare, it's that the cost of the healthcare that they're consuming is increasing at a rate that far exceeds inflation or what you would consider normal market forces. So, particularly hospital inpatient spending has increased significantly, and also prescription drug spending. There's a lot of geographic variation in how healthcare money gets spent nationally. And there are questions of why even in a single city does the cost of a C-section vary by 4 or 5 times.
Okay. We have known that for some time. Are we finding that there are improvements to bringing the costs down, given that we know where the costs are coming from now?
Well, I think it is definitely a big challenge. One of the problems is that healthcare markets are getting more and more consolidated, and so with more consolidation, there's less competition, and with less competition, it allows providers to be able to be less flexible in their negotiations with payers and employers. So it is, I think, one of the conundrums of U.S. healthcare today that we do actually understand more clearly where the problems lie, but we are struggling to develop tools to actually address those underlying problems. There's a lot of activity around value-based care, for example, and improved quality, and those are all very well-intentioned things that we need in the healthcare system. But the point that we make at the Healthcare Cost Institute is it doesn't matter if you're reducing care at the margin. You can be doing all the right things, reducing readmissions, reducing emergency department visits, but if the prices on the residual services that are still provided are increasing so rapidly, not only are we not treading water, we're actually sinking from an overall financial perspective.
Okay. Well, I did show you the list put together
Yes,
by
indeed.
members of their top concerns. Data and analytics. Data is an area that you work in every day. That is the top issue for members now. What is your concern or focus in this area in the coming days?
Well, that data and analytics is number one is music to my ears personally, because it's something that we specialize in and are very passionate about. I think the biggest concern I have is that data is actually being shared with less frequency across the healthcare system. More and more organizations are treating their data as a strategic asset that they shouldn't give to anybody under any circumstances. Mm-hmm. And the more attitudes and opinions like that start to harden, the harder it will be to actually take a good wide lens look at the healthcare system and understand what's going on.
Okay, so that's a real risk then. So what should we do about that?
It's a huge risk. One particular example is United Health Group has decided to actually end its data sharing partnership with the Healthcare Cost Institute. So we are looking at losing a significant portion of the data that we have historically possessed. So as to the solutions, these are tricky issues. I mean, I think health plans can choose to share their data with organizations like ours on a voluntary basis, which I would certainly very much prefer and welcome. PSA to any health plans out there, please give us a call. But I think there are also, increasing frustration levels in general are really starting to increase with the healthcare system. I think consumers and employers are very frustrated and angry with the cost of healthcare. I think the interesting thing is that's starting to really resonate on Capitol Hill and among regulators and Congress folks. So there are increasing efforts on the Hill that may actually accelerate a move to requiring this information to be shared on a mandatory basis through some federally supported program as opposed to a voluntary basis. So it's one of those classic situations where, is it better to be proactive and share the information in a way where you still have control over how the data is used, or potentially surrender a lot of control and have it become a compliance activity related to a federal or state law or regulation.
Is there any session that takeaways from a session that you thought was particularly interesting for the work that you do?
I think the session just before lunch actually was really interesting because, again, it highlights one of the fundamental tensions that we face in the U.S. healthcare system. It was a session focused on new technologies and startup companies and all the entrepreneurship and investment that has occurred in U.S. healthcare over the past few years. And I think, again, everybody acknowledges that we have this huge cost control problem. Everybody knows that healthcare is 20% of our economy, and some of these new technologies are great, but I think the evidence is, the jury is still out on whether these new technologies are just redistributing the 20% of the pie or among different actors, newer actors, or actually taking steps to maybe at some stage, make the 20% 19%, or at least keep it at 20% and not have it be at 23% in 5 or 10 years' time. So we talk a lot about ROI and things like that. And so ROI in healthcare can mean many different things to many people. A company can have an incredible return on investment, but actually be producing a technology or a service that is actually cost increasing on the system overall. So I think that's a fundamental tension. Historically, the best example of that is probably the pharmaceutical industry, which deserves enormous credit for introducing many, many new life-saving drugs. However, I think that there are increasing issues and questions around what is an appropriate launch price for a new and innovative drug. First it was crashing through the 6-figure barrier, and now we've crashed through the 7-figure barrier in terms of the cost of these new drugs.
Right. Okay. Well, I thank you so much for your comments, Niall. Very
My
interesting.
pleasure.
Yeah, hope
great
to
to
see
be
you
here.
again.
Likewise.